Barbara Stewart.
Thank you, Mr. Speaker. I'm definitely speaking on this. I rise on behalf of New Zealand First to speak on the third reading of the Health Practitioners Replacement of Statutory References to Medical Practitioners Bill. As others have said, this is a massive bill being divided into 8 separate bills, and basically the purpose is to increase the range of statutory functions that can be performed by health practitioners that previously have only been referred to as medical practitioners. So in this legislation, references to medical practitioners will be changed to references to health practitioners. Mr. Speaker, we are happy to support this bill in its third and final reading, and we're very pleased to see the bill reach this point. It has been a long time actually getting to this point in the Parliament. We would like to reassure the public that this bill is not about shortchanging those people who want to visit the doctor, visiting someone who's not qualified to carry out the task. These nurse practitioners are very capable, they are trained, and they have got the skills and expertise to carry out these particular jobs. It's more than just relieving doctors of time-consuming paperwork. We want to ensure that basically those practitioners that have got the skills and the expertise can actually use those skills and expertise for the betterment of the New Zealand public and New Zealand patients. This bill is needed, very much needed. We do need to change with the times, and we know that if we are to have a health system that responds to New Zealand's healthcare needs, that it does need to change. Many of the changes just remove bureaucratic barriers to providing care, such as the current situation of a doctor needing to sign off an assessment that can be carried out by health practitioners. As we've heard many members in this House mention on previous occasions, this can be particularly burdensome in rural areas where doctors are scarce. We are very concerned as to why paramedics are allowed to continue unregulated. We believe that paramedics provide a brilliant service to New Zealanders, carrying out advanced medical care in very trying conditions, often on the side of the road, yet there are no regulations to cover this, and their role in patient care needs to be recognised. So they need to become registered medical practitioners. New Zealand First will continue to advocate for the registration as paramedics, as professionals in their own right. We see this as an urgent priority, and we're disappointed that at this point in time they're not included in this bill, yet we hope that they will be. We know on this side of the House that we've got a looming workforce crisis, and we hope that this bill will actually ease some of the pressure. 44% of GPs intend to leave the profession in the next 10 years, with the number increasing since the previous year. In 2015, Health Workforce New Zealand reported that there were 52,729 registered nurses and 14,678 doctors. So this legislation is very important to enable nurses to carry out further duties. And of course, we're all very aware that there is a shortage of doctors in rural areas. As was mentioned by the Green Party and Labour, nurse practitioners do need to be paid more for their skills, so this is an area that we will be following very, very closely. We know too that our medical workforce is ageing. Health Workforce New Zealand reported that as of 2015, 40.1% of doctors were aged 50 or over, up from 35.3% 6 years previously. And the situation, unfortunately, is very similar for nurses. 45.2% of nurses were aged over 50, up from 40% in 2009. So it is very clear to us that we do need to develop a more flexible and adaptable workforce. We have got a workforce in crisis. We all witnessed the junior doctor strike recently, and that's just one example of this. Mr. Speaker, I'd like to conclude by saying that although this bill may ease a certain amount of pressure on our workforce, which is one of its intended goals, it will not solve the issue of an underfunded health system. Also, it won't have an impact on the concerns that we have in regards to the capacity of the workforce now and in the future to solve the needs of an increasingly ageing population. And of course, we've got the chronic conditions that are part of the health scene these days with obesity and diabetes. We've got high rates of immigration, and we've got a crisis just waiting to happen unless something has changed. So, Mr. Speaker, New Zealand First, we're very pleased to support this bill, and we look forward to its passing into law, and we know that it will be of great benefit to Kiwis. Thank you.
Jackie.